Namaste and good afternoon. Welcome to our Facebook Live session presented by Apollo Hospitals. This is Dr. Srinidhi Chidambaram, and I do hope that you've all been well and still taking all precautions for COVID safety. A medical emergency is an acute injury or illness that poses a great risk to a person's life or long term health. It may require the intervention of multiple levels of care from first aid through emergency care at a hospital, followed by admission, critical care, care by different specialists. But in most emergencies, the final outcome really depends on the actions taken immediately by those around the victim. So, whether it's calling the ambulance, recognizing the signs of an emergency, do's and don'ts, first aid, and that is really, and also above all, choosing the right kind of emergency service. These are the factors that really determine the outcome in most medical emergencies. But at the same time, it can be very overwhelming for anyone to deal with a medical emergency. So, we present this new series where we are aiming to discuss common medical emergencies and what to do if you're ever faced with it. Choking is one of the medical emergencies, and it occurs when a foreign object lodges in the throat or in a windpipe, blocking the flow of air. In adults, a piece of food is often the culprit. In children, it might even be because they swallow small objects. Choking cuts off oxygen to the brain, and so first aid is needed as quickly as possible. So, let us find out today on what to do if someone chokes. To guide us and explain this to us, I'm very happy to welcome Dr. G J Himaldev. Dr. Himaldev is a critical care specialist and has an experience of over 8 years in this field. He completed his MBBS from the Father Muller Medical College in 2008, MD from the Kasturba Medical College in 2012, and FNB in critical care medicine from the Narayana Hridayalaya, Bangalore, and also a European diploma in intensive care from Dublin. He's also worked in the Royal Adelaide Hospital Intensive Care Unit, Australia, and has gained experiences in advanced treatment modalities like ECMO. He is a member of the ISCCM, and he has won several gold medals, including that for the best outgoing postgraduate from the Manipal University in the MD examination. And his special interests are ECMO management, airway management, mechanical ventilation, trauma management, intensive care, and so on. And he's also published several research papers in various national and international forum and publications. So, welcome, Dr. Himaldev. Thank you so much for joining us today. And we are all eager to hear your advice on what to do if someone is choking.
Thank you, Dr. Srinidhi, and thank you uh, especially for bringing up this topic, which is very much in need, and not lot of awareness has happened at this particular topic, and unfortunately, not only the children, even adults have lost their lives because of inappropriate treatment. The problem with this is, in case if you don't do the necessary treatment in the right way, you can actually worsen the choking and cause much more problem. So we need to be aware what is the right step and how do we tackle the choking problems.
So let's begin right at the beginning and get the definition of what is meant by the word choking.
Yes. So choking is nothing but it's an obstruction of an airflow going into the lungs. So usually the trachea is the pathway for the airflow, and whenever an object or a food particle gets lodged inside the trachea, that is also called as a windpipe, that's when the airflow gets obstructed and there is no air flow into the lungs, so there is no oxygenation into the other parts of the body. So usually there is a hypoxia and they suffer cardiac arrest and sometimes brain damage also. So that's called as choking. This is different from gagging. Gagging is whenever a food particle or any object which get lodged in the esophagus, that is called as a food pipe. That may not be a medical emergency, unlike choking, which is a medical emergency and it has to be dealt as early as possible.
Are there different types of choking, really?
Yes, definitely. There are two types of choking. One is partial choking, other one is complete choking or full choking. Partial choking is something when an object gets lodged in the trachea, it doesn't completely obstruct the trachea. The trachea is usually circular. It only partially blocks it so that the airflow still happens. But whereas in complete choking, there is a complete obstruction of the airway, so there is no airflow into the lungs at all. So partial choking, if you see clinically the signs of choking, somebody who is choking, he'll usually grasp his throat, he'll clutch his throat, and he'll have staring eyes. His face becomes red. He starts sweating, and in partial choking, he can always can vocalize. He can make some sound. He can try to talk as well, but definitely there will be some sound. That means the air is flowing inside and outside. So it is not as such an emergency as a complete choking. But whereas in complete choking, whenever there is a complete obstruction, there is no sound at all. There is no voice. The person will be touching to his throat and he will not be able to make any kind of noise. And this kind of patients, suddenly they can go into unconsciousness and cardiac arrest. So they can turn into medical emergency as early as possible.
So how does a person around, like, how do they know, like, whether this is like a really, as you said, a complete choking and a medical emergency, or, I mean, you can kind of seek medical help, but it's not an emergency. Are there any ways to tell, apart from the fact that you said that the noise, there won't be any sound?
Yes. So usually whenever a person who has recovered from choking, if you ask him how was the experience, he always says the life flashed in front of my eyes. So it's that horrible experience. The person who is having a partial choking can go into a full choking eventually if it is not treated. So the medical emergency is when the patient goes into a full choking. There is no airflow, there is hypoxia, and eventually they'll go into unconscious state. That is where the real emergency handling lies in. So that's the full choking is the one which is a medical emergency and it has to be dealt urgently.
So what are the common causes of choking?
So the most common cause, two-thirds of the causes is because of the food particles. So anybody can choke on any food particles, but most commonly the babies and the elderly, where the swallowing reflexes and the gag reflexes are not so good. So these are the subset of patients who have choking problems. If you look at the US data, I think every 5 days one child dies because of choking. And if you compare it to India, definitely the Indian data will be more. So that is the seriousness of the incidence of choking conditions. And the other reasons for choking is you're taking a bigger bite of food, like for example, a large piece of meat or large piece of food product, eating it fast and eating while lying down. And sometimes when you're talking or doing some activity, running around and eating, and most commonly in an intoxicated patients, like a patient has consumed an alcohol just before the food, they are the ones who are commonly affected with choking, and that's how they end up with the problems.
And when,
And
sorry,
sorry to interrupt.
no, please.
And in kids, other than the food particles, the toys, the smaller toys, actually the toys will come with a prescription that it has to be above certain years of age.
Yes.
But if it is not done in the right way, they can choke on the smaller bits of toys, batteries, smaller batteries, buttons, and some of the food products like larger pieces of vegetables. And most notorious things are the nuts and the vegetables. The problem with these are if they get into the trachea, the windpipe, once they go inside, because the water content inside the windpipe, they start swelling. So even the partial choking can become a complete choking over the time, and it is very difficult to remove that as well. So these thing the parents and everybody has to be very aware. These small nuts and small vegetables has to be kept away from the children or should be given in a smaller pieces under the supervision.
So when you say that infants also can choke, what would they choke on? Because they would largely be fed on milk, and they may not be old enough to, put toys into the mouth. So what do they choke on?
Infants can choke on breast milk itself.
So,
The breast milk itself, they can choke, and so that's one of the cause for the choking. Yes.
um, so coming to the actual first aid. So what should be done if somebody around you is choking?
Okay. So I'll divide this according to three aspects. One is in adults, the other one in children, that is below 1 year of age. So the first thing, whenever somebody is choking, the first thing to do is call for help. So immediately you see somebody is choking, you call for help. If somebody is with you, you ask them to call for help and you start the process of first aid. If nobody is around, you have to make a call and then start the first aid. If you are the person who is choking, then also, if possible, you try to make a call or try to call for help before you do the procedure on yourself. So in case of adults, what we do, a procedure is called as a Heimlich maneuver. What we try to do is, if the person is choking, as I told you, they will be having universal sign called as clutching. You don't ask them whether are you okay. You ask them whether are you choking, because patient can have respiratory difficulty because of an asthma or because of any other cause. So if he nods his head it's because of choking, then only you go ahead with choking maneuvers. Otherwise, if you go on doing choking maneuvers for some other respiratory illness, it is going to worsen the things. So what we try to do in Heimlich maneuver is, you stand behind the person who is affected with the choking, and you have to put your one foot in front and one foot behind, or in between their legs you stand, so that you have a stronger support. You make a fist, and you put the fist, you make a fist and put it behind above the navel of the person from behind, and you grasp it from the other hand. It has to be just above the navel, and one shear pressure, one it should be pressure should be inwards and upwards. So you give this pressure, and because of this pressure, intrathoracic pressure, whatever food contents or any particles, that will come out. So this is called as abdominal thrust or Heimlich maneuver. So why do we stand in a different ways? If the person eventually becomes unconscious, he should not fall on you and you should not get hurt yourself. So you have to support yourself first, hold it this way, make a fist and give a good abdominal thrust so that the choking particle will come out. Because this maneuver is so important, because this is anatomically creates such a good pressure. So even if it is a complete obstruction, there are chances that it can relieve the pressure. Suppose the patient becomes unconscious or unresponsiveness because of complete choking, then this maneuver won't help. So you have to make him lie down on the flat surface and you have to start the cardiopulmonary resuscitation. That is nothing but chest compression. That's a completely different aspect. So this is in terms of an adult choking scenario. So what you have to do is just give a Heimlich maneuver. Suppose a child below 1 year of age has a choking problem. The first thing to do is, do not blindly sweep the mouth of the child, because what you can do is you can further push the foreign body inside. So if the choking material is seen outside, you can pull it out, but do not blindly sweep. I'll show you a technique how we actually do the choking maneuvers in child. If the child is choking, you have to hold the child, support the child this way with your left hand, and make the child lie on your forearm and on thigh, and hold the child like this, little bit head and down, and with the heel of your hand between their shoulder blades, you have to give 5 thrusts. 1, 2, 3, 4, 5. So this is how. So whatever the choking material will come and get stuck here. So after the 5 thrust, you have to turn the baby. Still the obstruction is not relieved. Between their chest, breastplate, you have to hold 2 fingers and you have to give 5 thrusts. 1, 2, 3, 4, and 5. So this has to be continued until the choking material comes out of the child. So usually with these back blows, this particle will come out. If suppose with this back blows 5 thrust and 5 back blows, the particle doesn't come out, child becomes unconscious, then the child has to go for a CPR. Just like adult, you have to go for the child CPR. So this is the basis of an adult choking first aid and the children choking on the children having the choking. This is how you do it. This is the maneuver which has to be tried. Do not hold the child anytime this way. This is a common practice when we try to do, when the child is choking on a coin. That's what they try to do, and try to do back blows. It will worsen the um, blockage, and it can cause spinal injury as well for the child. So this is not at all done. So it always has to be a back blows and the chest thrust.
So the child has to be put prone on the
Yes.
on the thigh of on your thigh when
Yes,
you sit, and
yes.
then
So when the child is prone on the thigh, you give 5 thrusts. Suppose the object comes out, you can turn the baby and take it out. Otherwise, after completing the 5 thrusts, you turn the baby and see if the object is in the mouth. Take it out, not blindly sweep again, and you make them lie again supine and give chest five chest thrusts. Still, the patient baby is choking. You continue the same maneuver again and again until the foreign body comes out of the babies.
and what about older children? Is it the Heimlich maneuver for them as well? For children
Wonderful
who are
question.
standing.
Yes, it's in above children of 1 year of age. It is the Heimlich maneuver. Only thing is you have to kneel down in front of the baby, and the same maneuver at the same anatomical space. You have to give the Heimlich maneuver, 5, 6, or 7 abdominal thrust, and the foreign body has to be taken out. Yes.
So normally, what is the role of the like you said call for help. So now, what would be the role of the emergency team or the ambulance team? So what would they do in case all this is not working out?
Okay. So generally, we suggest whoever is doing the maneuvers, these abdominal thrusts. So we tell them to continue until the paramedical or the doctors arrive. So we also take over. Once we take over, we'll be continuing the same maneuvers until the patient becomes unresponsive. If the patient becomes unresponsive, of course, we'll start doing the cardiopulmonary resuscitation. And if the person is airway trained, if he is able to put the endotracheal tube or some tube into the trachea, then that's where we try to intubate the patient and take them to the higher facility and possibly involve a surgeon or surgical equipment and try to remove the foreign body out in the operation theater or in the emergency itself.
So, if somebody is choking, what like how we have the the golden hour for stroke and all those things. Like so, for choking, it must be even a shorter period of time. So, what I mean, obviously, people have to act very fast. So, how many minutes would ideally, like I mean, how quickly should this be started, and after how long does this kind of not really work?
Right. So if it's a complete choking, absolutely there is no airflow inside the lungs. Generally, they say by the end of 5 minutes, the brain cells start suffering because of lack of oxygen supply, and by the end of 10 minutes, there will be an irreversible damage to the brain. So generally, I think it has to happen within minutes, as early as possible, and I think it should not be delayed beyond 5 minutes. But in case of partial choking, still the airflow is going up and down. You still have a chance. So in that scenario, what you have to do is you have to encourage them to cough more. If this person is having a partial choking and he still has the voice coming out, and you know it is a partial choking, you encourage them to cough more and let the foreign body dislodge itself on its own.
The common practice, which sometimes people kind of say, is drink water to get it down. So I suppose that's not the right thing to do at all. I mean,
Yes, I think rightly bought it. You should not drink water because it can worsen the choking. The person can choke on water itself, and it can push the foreign body further inside. So absolutely no drinking water, and even no blowing air into the mouth. Or again, I told you, no blindly sweeping the finger inside the mouth. Those are all wrong practices. We should not be done.
but I think the confusion at that time usually is that people cannot differentiate between something stuck in the food pipe and the windpipe. So when it comes to something stuck in the food pipe, I suppose drinking water might help to push it down. But so there again, like I mean, there is a confusion about what is gagging and what is choking. So maybe you could explain that a little more.
So gagging, as I told you, is, as rightly said, it is the food particle stuck in the throat, and they will not have these kind of symptoms, and the patient will not be as distressed as in case of a choking. So in
So
that case,
what would they have? Like what kind of symptoms would that produce?
they just gag. That's gagging is whenever you put a finger inside the behind the throat, they just gag.
Red.
They won't have redness. They won't turn blue eventually, and they don't have the that popping eyes, sweating, and stillness. So because the air is automatically, and patient will be able to vocalize also in case they'll be able to tell I'm gagging, has something in the throat. But in case of choking, he'll not be able to vocalize that much. So clearly, you can differentiate gagging, and gagging will not be a medical emergency because it's the uh, particle in the esophagus. So either it will go inside or it will come out, but the air will be going inside the windpipe.
Yeah.
So, but still, if there is a confusion between gagging and choking, I would not suggest making them drink water at all. Yes.
And if it is gagging, is there anything that we should do or just leave it?
The gagging, in case you can, if there's a confusion, definitely there's choking, the same maneuver can be continued. If the food particle is there, it will bring it out. The Heimlich maneuver can be done. But generally, the gagging will go down eventually with their own efforts itself. Yes, with the gulping effect itself, it will move further down. Yes.
So we already discussed, what are the do's and don'ts, but just to summarize, I think for the don'ts, you have definitely said, do not put the child upside down and do not drink water. So any other things which should not be done?
Uh, so in the don'ts aspect, the first thing is whenever you see a person choking, don't try to ask them, "Are you okay?" You ask them, "Are you choking or not?" And if the patient is not able to vocalize, he will definitely say, "Yes, I'm choking." If he doesn't have a choking problem, if he has a breathing difficulty because of bronchial asthma or something, and he will tell it's not because of choking, it is because of some other respiratory distress. And try to keep away all the smaller particles away from the children. And whenever you're doing a CPR for a choking person, don't try to give mouth to mouth respiration immediately. The chest thrust, what you give, that itself will bring down the foreign body outside. And as I told you, don't hold the baby upside down. And these are the don'ts. Generally, we don't recommend for the choking patients.
Also, if somebody is, like especially if they're advanced pregnancy, or if they are also like, there might be somebody who's very obese also. So in such people, what should be done?
So in these patients also, in these subset of patients, here also you have to give an abdominal thrust. But of course, you can't give abdominal thrust because they have an abdomen because of pregnancy as well as obesity. So what you do here is the same kind of fist position. With the one hand you make a fist and the other one you grab around the person. The standing position is also same. But only thing is it will be higher. In the initial part, we keep it above the navel, below the breastplate. In these patients, you keep it at the level of the breastplate and give that chest thrust so that the force is created and the foreign body comes out. So the position has to be a little above. That's the only difference which you do in a case of a pregnancy or an obese patient.
Is there anything else that you would like to tell our viewers about this choking?
So the main thing is, if somebody is choking, you need to know exactly the right maneuvers to do it, because if you do it wrongly, you can cause more harm than help. So you need to go through the videos of how to save the choking and listen to some of the videos, especially the parents, and also the elderly caretakers of the elderly. They need to know the process of first aid in choking, because a lot of lives will be saved in this particular aspect, which is quite easily manageable, and if it is done in the right time and right way. So this is a very important topic which has been brought up from your side, and I really appreciate for this session.
So, but thank you first, Dr. Himaldev, for this amazing discussion. And viewers, please connect with our Facebook page if you have any further queries. But as doctor said, please go through videos and other material on this subject and go over what doctor has said today, because I think choking is something that can happen at any time and we need to be prepared. And also subscribe to our YouTube channel to see some of these videos. Any medical emergency is an alarming situation and you can get very anxious. But the first and foremost thing to really do is to remain calm and composed and take help at the earliest, and take always, like, you yourself have to stay calm, to take steady yourself, take deep breaths so that you can handle the situation. Being aware on what to do is also equally crucial in determining life or death in an emergency. So be aware and take care. And also, please know that at Apollo Hospitals, we are available 24 by 7 just need to get in touch with 1006, and then there is a highly skilled network of paramedics and emergency doctors and nurses who are always there to handhold you through any medical emergency. Thank you. Take care. Namaste.